the volume actually started going down. People don't really understand neuroplasticity. Without the teaching and the counseling piece, you probably won't get very far. I think tinnitus retraining therapy has been it's been a revelation for me.
We have James as well as Dr. Sarah Matthews. And in this particular conversation, this particular presentation here, we will talk about tinnitus retraining therapy in practice. So let's start off. James, could you please give us some introduction into where you are today and where you were when you started working with us at Treble Health?
Sure. Well, where I am today is a much, much better place than I was when I came to Treble Health in October, the first week in October, actually. My tinnitus on a scale of 1 to 10 was probably a 7 to 8. I was demoralized. I felt that I had lost my quality of life. It was annoying. It was frustrating. It was all those things. And as Tamara said, I put on a face and forged ahead. And I had already seen Dr. Ben. The first video that I saw of Treble Health was Dr. Ben talking about tinnitus, stress in the limbic system, and it fascinated me. It was the first thing that I had ever seen that really educated me on what was happening to me. My perception of tinnitus was causing a negative reaction. It was sent to the limbic system as a package of stress and anxiety, and the amygdala, the fight or flight response, was kicking in, and then it was making the tinnitus even louder. So I felt like, aha, I know what's going on now. So I started watching more and more Treble Health videos and getting more educated, and finally came to the point where I contacted Dr. Sarah for an appointment, and it was upward from there. Where I am now is I think it's exceeded my expectations. Actually, I was somewhat skeptical at the beginning that TRT, tinnitus retraining therapy, could actually do what it's done for me. And I think that it's a bit magical, really, to watch it unfold, because a lot of things happen. Your brain actually does things at a subconscious level. Once you habituate to your reactions, your negative reactions, the rest of it's automatic. And that's what's so incredible about it. And that's what's happened to me. Right now, the sound that I'm hearing is between, I would say, usually between a 1 and a 3. And I've had a lot of days, and I took Tamara's advice in her video. She said she likes to go through her calendar and put down numbers for different days on her, volume. Well, I put down GR for great, G for good, G plus if it's a little bit better than that. I started noticing that about a month and a half to 2 months in, I was seeing a lot more GRs, Gs, and 3 things were happening. And this is what was fascinating to me, really. Number one, the fluctuations or spikes. Dr. Sarah doesn't like me to say spikes. I like to say spikes, but I'll say fluctuation to please her. And it is better, actually, to do it that way. But I stopped having as many fluctuations. The fluctuations that I did have were far less severe, and the volume actually started going down. And that's the part that astonished me, because I really did not expect that to happen. I had heard, well, you'll have changes, and yes, you'll learn to not let it bother you so much. But as far as the volume going down, no, that's kind of a Candyland. That's a fantasy. So, forget that. But it's happened for me. I'm here to tell you. And I think if you follow the tinnitus retraining therapy guidelines, if you do consistent sound therapy, and I mean 12 to 16 hours a day is what I do. I put them on as soon as I get up. After I'm out of the shower, I wear them till I go to bed, most days. Now, I've had some days where I've had some sound sensitivity, and I can't wear them that long. And I think, Dr. Sarah told me not to white knuckle it on those days. And I've been doing some protocols for some sound sensitivity issues, but those have gotten better. Those have gotten better along with the tinnitus. So I'm in a great place today. And I think tinnitus retraining therapy has been it's been a revelation for me. And I know that it's really what's brought about the changes that I see, that and phenomenal audiologists.
James, let's bring in your audiologist that you worked with on our team, Dr. Sarah Matthews. Sarah, what kind of history or background that James had is fairly representative of other patients that you see?
I think some of the consistent things that I see across the board is that when he started with us, James was stage 1, stage 2 of habituation. And that's where the majority of our patients are when they start with us. And James was also very motivated, which most stage 1 and stage 2 patients are, because this is affecting your entire life. I also think that one of the common things that we don't talk a lot about is that he had some pulsatile tinnitus. And there's this huge misunderstanding in the tinnitus community that tinnitus retraining therapy, sound therapy can't help with pulsatile tinnitus. So it's not the most common thing we see, but it's really common that we see pulsatile tinnitus patients. And one of the things that I, as a clinician, missed in the beginning was the sound sensitivity piece. And I think that that was there from the beginning. And that's very common for us to see is patients coming in with all of this and then an overlay of some sound sensitivity as well. I think some of the things that were a little different, I'm also going to take this in a different direction. James is a very knowledgeable person, which most of our tinnitus patients are. We know as tinnitus patients, we dive in and we research and we try to figure out what's going on and where do I get help. And the answer of there's nothing that can be done does not sit well with us. So we try to figure it out. By the time James got to me, he'd already read Dr. Jastrovoff's book. And that's a little different than most patients. And I love it because he keeps me on my toes. When we talk about something, I know that he knows what we're talking about. And I know when we start to talk about particular protocols or processes or activities, he already has that underlying foundation of information. And when I do something that's off of protocol, he knows. And we talk about why are we going to do this little thing different, or what can we do that brings us back to staying on target with things, because he put in that effort to read the TRT book.
Excellent. And for those who don't know, Dr. Jastrovoff is the founder of Tinnitus Retraining Therapy. There is a book available that he wrote that is available for patients to read, and it's often complementary to what we do. Here we go, a nice plug for the book. And James, let's ask you some questions here. Let's go straight into it. Talk to us about the tools that you used. Let's start with sound therapy. For those who are fairly new or don't have much introduction to it, what is sound therapy? How do you use it? And what has it done for you?
Sound therapy was really key in all this. And I'll qualify that by saying, and Dr. Sarah and I have talked about this too, but you can slap ear level sound generators on anyone, but without the teaching and the counseling piece, you probably won't get very far if you don't understand what's going on. And Dr. Jastrovoff said that in his book, actually. And so sound therapy to me, first of all, is getting even a little bit of relief from that sound that you're hearing, like Tamara said, so that you're freed up to pursue habituation. You can't really, if you have a jet engine in your head, as I have said sometimes when I wake up from a nap, that's how I feel. I hear that jet engine sound, not so much anymore, but if you have that sound going on and you don't have any relief from it, it's very challenging to move forward. So sound therapy was very important to me. As soon as I talked to Dr. Sarah, I realized I needed the ear level sound generators to really move forward at the pace that I wanted to. So I ordered those, and they've been fantastic. I didn't have a hearing loss per se, really. In fact, my hearing test that I sent to Dr. Sarah showed no hearing loss at all. I had a prior one about, it was in December of 21 that showed mild hearing loss at upper frequencies, but for some reason I didn't have it in the most recent one. So I got the maskers, the ear level sound generators. And you really, with the pink noise, and I believe pink noise is where the spectrum, every sound on this frequency on the spectrum is equal. Is that right? As opposed to white noise, where the white noise has more upper register. The pink noise to me is really hard to detect. Once I set it in the morning, I set it and I forget it for the whole day. I wake up and my volume that day, and I never know what I'm going to get, so my volume that day might be a 3. Well, I still use the sound therapy, only I'm going to put it a notch or two lower than I usually do. So I can still hear the tinnitus signal, but I can hear the sound therapy as well. And that's what I always do. You always want to set your sound therapy right below the threshold at which it starts to partially mask your tinnitus, because your brain has to hear that tinnitus signal as well as the sound therapy in order to make the comparison. And the brain is jury. It has to get that evidence that the tinnitus is no longer bothersome and shouldn't be treated as important. And then the brain will refile it. And I think that's what's happened in my case. It's refiled the tinnitus in a place where it's not only lower volume now, but it doesn't upset me. I've had a few days where, like I said, I'd wake up from a nap and hear a jet engine in my head. Doesn't bother me in the least. I identified with a video that I saw. A musician named Isabel Anderson said that she went through the treatment, TRT, I believe, and she said, somebody asked me if they'd like me to, turn the switch off. I'd say, if you want to, that's fine, but don't have to. That's the way I'd like to be ultimately. I still get a little annoyed at times, but I'm almost to the point where I feel that I'm closing in on stage 4. I mean, I've graduated for all intents and purposes because I don't get upset anymore. It doesn't have a big impact on my life like it did in the beginning. And I feel like, yes, I have times when I notice it more and times when it flares up, but I can deal with all of those things. And in the very beginning, I had some really, really dark days. I won't trigger anyone. Wouldn't ever want to do that, but trust me, they were bad. I think we've all been there.
James, thank you so much. And we can hear your authenticity and your willingness to share from a vulnerable place here. And I know personally, after speaking with you multiple times, that you found the value in this protocol, this system, tinnitus retraining therapy, and you want to educate others. So what do you think are the biggest misconceptions about it for those who may have heard of it, or even for those who don't know anything about it? What do you think are the misconceptions in the world of tinnitus?
I think as far as TRT goes, I've heard people say it's hocus pocus. I've heard people say it's just a delay for real treatment, whatever real treatment is, because there are so many types of tinnitus that you would have to find a cure for. There's not one cure. And I've also heard it said that you'll get addicted to sound therapy. And that certainly isn't true. Once you are habituated, you're not really going to have a need to slap those ear level sound generators on, unless you have a point in the future when you have a fluctuation or something. But I think those are all misconceptions. People don't really understand neuroplasticity, and it's a fascinating thing to watch unfold. At least it has been for me, and to hear from other people on Treble Health who have talked about their experiences. But it's not magic. It's not hocus pocus. It's simply new neurons forming as the brain relearns about tinnitus, that it's not a threat anymore, and new neural pathways are forming. And great things start to happen. You start to notice, you start to not notice it, is what happens. You do notice a reduction, definitely. But I think people don't realize how real and how powerful neuroplasticity really is. So that's what I would say about TRT. About tinnitus itself, it's all in your head. You can just pull yourself up by your bootstraps, get over it. I have floaters in my eyes. I have for 30 years. Why can't you listen to a little ringing? Things like that. And it is true that a lot of people are not bothered by tinnitus. I wish that were the case with me. And I don't know what the percentage is, but I know a lot of people just don't ever get bothered by it. So I think the conception that it's all in your head, or that it's a psychological problem, that I've heard that too, that it's a psychiatric disorder, that it can be treated with eardrops, garlic, things like that. I have no patience with all those things. And I just loved the video clip that you did. It was a quick quick one on bogus medications for tinnitus, because there are a lot of them out there. But yeah, tinnitus, it's the woman whose family didn't understand one night in group therapy, who didn't understand her problem with tinnitus, her bothersome tinnitus, really got me right here, because you had to feel for this woman. She was coming from a place of just desolation, because she really didn't have anybody at home that understood what she was going through. And at the same time, you can see how the family, none of whom had tinnitus, would be frustrated at the condition and not really know what was going on. And I think that's where educating yourself comes in. We need to keep reading. As we progress through the TRT process, we need to keep reading, keep learning, and that's what I'm doing. I stay away from the boards, though. Stay away from those boards. They are toxic, toxic, toxic. And, if you can pry yourself away from those and focus on academic literature, books like Glenn Schweitzer that you had on, those are interesting. Things like that. Keep reading, keep learning, watch Treble Health videos. They're so educational and they're so inspirational.
Thank you,
Thank
James.
Yeah, absolutely.
So you had shared some tools, mainly sound therapy, working with Dr. Sarah.
My speaker.
Your speaker.
Yeah, at night.
And you mentioned ear level sound generators, which we also call tinnitus maskers, and
yes.
they can also be called hearing aids for tinnitus, but making sure those are programmed according to the tinnitus retraining therapy protocol. Mm-hmm. You mentioned that those tools were helpful, as well as the education, learning about this system, taking any what ifs or fears or anxieties out of the equation, and knowing the system, how it works and how to follow it. So those are the tools. I summarized those. We're now going to transition into some advice and then finally some words of encouragement. So we have some questions coming in. Here's the first question. James, how long did it take you to get from stage 1, the most intense stage of tinnitus, until where you are now? Let's start there.
I believe, and I'll have to defer to Dr. Sarah here, because I was in stage 2 for quite a while, even though I was doing really well. But I took the tinnitus functional index equivalent, and I had gone from a 68 to maybe a 28 or something like that within 3 months, maybe a little more. Maybe it was October, November, December, January. It was 3 months. It was about 3 months. Mm-hmm. It was fairly speedy, and I had a concern because I had been tapering off of benzos. I was prescribed clonazepam early in the process to help me deal with the tinnitus while I was going back and forth to Colorado, taking care of my dad's business after he died. And I really got a lot of relief from it for the first 5 or 6 months, but I shouldn't have been on it that long. And, it stopped working, and then I had to taper off of it. And I know Dr. Jastroboff has said that it can interfere with your brain relearning. In my case, I was taking such a small dose that it really didn't that much, but I was really sensitive to it. And I've told Dr. Sarah, every time we've made a cut, I've had a fluctuation that lasts a week at least, and then it goes away. So you have to be really careful with benzos. That's my unsolicited, not advice, but just kind of from one tinnitus sufferer to another. Really careful. Talk to your doctor, and I'll leave it at that.
Yeah, thank you. Second question here is for you, James. People say habituated, and you've shown signs of these ongoing stages of relief on the stages of habituation. So not fully habituated, as you've described. Your process here, it's not completely over. We still have more progress that we can get. But how would you describe this ongoing process of more and more habituation to someone who's not too familiar with the term?
Habituation, to me, was reaching the point at which my bothersome tinnitus really didn't bother me too much anymore. And I've really, for all practical purposes, reached that point. I'm in stage 3 solidly, and almost to stage 4. I'm being very cautious here, because you don't want to force anything or take anything too fast. But, as Dr. Sarah told me and cautioned me at one point, when you get to stage 3, you have to double down. That's where the hard work really begins. You actually don't let up, because if you do, you can backtrack, and I don't want that at this point. So I'm being very careful. But I went from stage 1 to stage 2, sat there for a minute, about 3 months maybe, and then kind of just slid into stage 3. One day I was just kind of amazed that I wasn't upset at the fact that I had a really ugly fluctuation. But I was like, and, so what? And I'd never done that before. And so I knew that my brain had rewired. I didn't know to what degree, but I knew that the process was working. And I said, thank you, Dr. Jastroboff. and a lot of other people too. So,
absolutely. Dr. Sarah, any input, any pieces of advice here for others who have a similar story as James?
I think the biggest advice is take action. We can help. And that's the thing, is like, we can lead a horse to water, but we can't make him drink. So if you've learned all of this and you know that these are options, do it. I've yet to have a patient that really has massive regret over working through tinnitus retraining therapy and having habituation as that end goal. And that's the biggest advice I can say is, let's do it. Let's make life amazing again for you.
Yeah.
Thank you.
And that's what the whole thing is taking back your life. I feel that I've been able to do that thanks to Treble Health, and thanks to tinnitus retraining therapy, Dr. Sarah, Dr. Ben. You all care. And one thing that was really telling, and I have to say this, and I hope a lot of people are listening, is that Dr. Ben has had on people like Cliff Olson, Julian Cowan Hill, Ed Farrer, Gary, I'm trying to remember all the names, but some of them are competitors. And he has these people on because he wants to collaborate with them to share information and help people suffering from tinnitus. That is the ultimate sign to me that Treble Health is in the right place as far as the tinnitus community. And I think it's the best resource out there.
I want to kick it to you here. We have a few minutes here for you to share your words of encouragement. You've already shared a lot of encouragement, but we can't get enough of it. Final words of encouragement for others who are listening.
If you're suffering from tinnitus and you are at a point where you feel like you want to throw in the towel and just live with it, don't. Do what Dr. Sarah said. Take action. There's plenty to do for tinnitus. Don't listen to so-called professionals that tell you there's nothing that can be done. These people are possibly well-meaning, but they're not well-trained. And I ran into quite a few of them. I saw a variety of doctors, a smorgasbord of them, really, and was totally demoralized. And I really believed what they said, that I would just have to live with it. Part of me did. Part of me said, no, I've got to find a solution. I know there's one out there. So I'm glad that I did this, that I did take action. It wasn't easy, but help is out there. You can do something for tinnitus. You can get your life back. And I think once you start the process and you start getting better, you have to be consistent. You have to be mindful, and you have to be positive. Stay positive, because as other people have said, it's not a linear process. You take 2 steps forward and you take a step back. And it's like a roller coaster ride. It's kind of a cruel process in a way, because you get really elated at where you are, and then bam, you're back where you were a month ago. But it's not going to be as long this time. It's going to be, increments, and you're going to notice little changes, and it's going to happen. So stay away from the naysayers, stay away from the boards, do something about your tinnitus today. Do something. There's help out there. I don't know how else to say that, but don't just be miserable. You can take back your life. I did.